Consolidation is one of the main drivers of increased healthcare costs in the United States. When fewer and fewer health systems control more and more of the healthcare market, we see reduced competition, and they're able to set prices without regard for the actual cost of care for patients or the impact on access or equity. I'm Sam Hatzenbuehler, Senior Policy Associate with the Economic Opportunity Institute, and I'm here to talk to you about hospital consolidations. In the past, our healthcare system really used to mostly consist of small local clinics and hospitals, which were uniquely suited to care for our communities. Healthcare has really become more corporatized in recent years, and that has really left the focus to become more and more centered on profit and revenue rather than on prioritizing patient care and access.
We have really troubling new details about a new mom's death and our ongoing look at how private equity investors have siphoned hundreds of millions of dollars from community hospitals. One company's efforts to squeeze out profits left their healthcare system reeling.
Our healthcare system used to rely on fair competition to really keep prices down and maintain quality and access. Consolidation takes place when a company acquires, merges, or affiliates with another company. And consolidation can really happen in two ways. One is horizontally, when a company acquires or merges with another one of its competitors, or it can happen vertically when a company basically buys up aspects of our supply chain. An example of this is when a hospital buys up clinics or pharmacies so that a patient hits on the same company at every point in the healthcare delivery system. The evidence for how consolidation increases prices is well established at this point. Horizontal consolidations can increase prices in hospitals between 20 and 40%. Vertical consolidation can increase prices by up to a third. When giant healthcare systems take over community hospitals, we have seen that they will sometimes close units, for example, labor and delivery departments, that aren't as profitable. That leaves patients having to drive hours to get to the nearest facility.
Maternity care deserts see no relief ahead as hospitals across the U.S. continue to shutter labor and delivery units.
This is made even worse by Catholic consolidations. When we talk about how Catholic-run hospitals restrict care, it's important to talk about ethical and religious directives. ERDs, they are a set of policies that come from the Catholic Church that basically govern how healthcare institutions that are Catholic operate in the U.S. These ERDs prohibit a wide range of health services, including all birth control methods, abortion, and some methods of treating miscarriages and ectopic pregnancies. And it's important to note that a lot of these nonprofit hospitals have what we call fair share deficits, where the amount that they are contributing to community benefits like charity care are actually far outweighed by the amount of federal tax breaks they receive. What it comes down to is that we need a healthcare system where caring for patients is our top priority, not revenue growth. It's time to put people over profit.